Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, May 19th. We are joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen and French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin, I'd like to verify that everyone can hear us. And if any of the reporters are having a problem, please email ecoinfo@yukon.ca. Premier Silver.
Thank you very much, Pat. Good morning, everybody, and thank you for joining us again today here on the traditional territory of the Kwanlin Dun and the Ta'anquachin Council. I'm very pleased to be here with Dr. Hanley and the team. This week we reached an extremely important milestone in our fight against COVID-19. As my new Health Minister, Tracy McPhee, announced earlier this week, more than 75% of eligible adults in the Yukon have now received their first shot of the vaccine. This is absolutely great news for Yukon and also for Canada as well. And I want to thank all of the dedicated individuals in our government and all of our partners in each and every community that have contributed to this collective and historic effort. It really has been a Team Yukon effort, and there is no team that myself and Dr. Hanley and Mary would rather be on. I'm elated, but I'm not surprised by the efforts of Yukoners. We are a hardy stock, and history has many examples of our extraordinary efforts. Whether it was Joe Boyle's machine gun company's mighty efforts during World War I, or the Dawson City Nuggets traveling overland by sled, by train, coastal steamer, and transcontinental train to Ottawa to challenge for the Stanley Cup, or the group of First Nations leaders who traveled in 1973 to Ottawa to present Together Today for Our Children Tomorrow, which started Yukon on the pathway towards the most comprehensive self-governing agreements in Canada. Yukon has a history of stepping up. This generation's efforts will be added to this list. Canada's Chief Public Health Officer Dr. Theresa Tam recently called Yukon a model that we are looking towards for success. We are leading the country when it comes to vaccinations, and that work continues. Last week, Minister McPhee announced that we have made arrangements with the federal government to obtain enough Pfizer vaccine doses to get all Yukon's youth ages 12 to 17 vaccinated. The details of the youth vaccine rollout were released yesterday and can be found online at yukon.ca. The first clinic opens on May 31st to all youth age 12 and up. They will receive their first shot before the end of the school year. I know that this is welcome news for parents and for our youth who want to do their part to help protect our communities. I encourage our youth and all Yukoners to step up and get their shot. The more people that we get immunized, the safer our territory will be. I also want to thank everyone who has already stepped up to get their shot. The vaccine uptake to date has been so great to see. It means that we are in a position to start lifting restrictions as part of our Path Forward plan. 2 weeks ago, we announced our plans to start lifting restrictions. One of the changes that we are looking at is that fully vaccinated individuals will no longer need to self-isolate upon entry to the territory as of May the 25th. These individuals will need to declare that they have been fully vaccinated, which means 2 shots, and at least 14 days since the second shot. They will also need to provide consent for the verification of their vaccine status. This is a new initiative that we are leading. We are working with our partners across the country to sort out the details of what verification will look like. There are important privacy concerns, as Minister McPhee has noted, and there are also important public health concerns. I want to be clear that this change in our self-isolation requirements will mostly benefit fully vaccinated Yukoners that leave the Yukon and then return. This is for a couple of reasons. First is that we are ahead of the country when it comes to vaccine rollout. Over 67% of eligible Yukoners have received their second shot already. We are pleased to see an increase in vaccine uptake in other parts of the country, but many Canadians have not yet received their second shot and are not yet fully vaccinated. It will also be easiest for us to verify the vaccination status of Yukoners that have received their shots as part of our vaccine rollout. We will also be in a position to verify the vaccine status of British Columbia residents, thanks to our close working relationship with that province. Now, we are currently working with our partners in other jurisdictions to sort out how verification will work. But we're not there yet. This work is ongoing across the country, and we look forward to sharing more information as it becomes available. The other change that we have discussed is that bars and restaurants will be able to return to full capacity for table service as of May 25th. I know that Dr. Hanley and his team have been working on outlining the public health guidelines for these establishments to ensure that they can safely welcome more customers just in time for the summer season. It is also great to see the City of Whitehorse is moving forward with plans to allow pop-up patios this summer. I think that's fantastic. We offered our support for this initiative last year, and it will provide more opportunities for these businesses to get on the patio and also get on the path of recovery. I also want to touch on some of the other areas as we're looking at changing next week based on new recommendations from Dr. Hanley and his team. We are looking at increasing the numbers for indoor social gatherings to 20 people and outdoor gatherings to 100 people with physical distancing and masks. We are also looking at increasing organized gatherings and events to a maximum of 200 people if the venue can accommodate with physical distancing. So this would include things like funerals, weddings, and faith-based services, as well as cultural events. I know that it has been a long time since people were able to gather together to celebrate life events and grieve the passing of loved ones. As we look towards the summer and the return of camps and recreation programs, we are also looking to increase indoor limits to 20 people and outdoor limits to 100 people. As these restrictions are lifted, it will still be important to practice the safe 6+1. We are in a fortunate position because of the diligence of Yukoners, and we do need to keep up that diligence. The variants of COVID-19, they still remain a very real concern. And we know from watching developments in other jurisdictions just how quickly things can change if we're not careful. So please, keep up the good work and continue to keep your friends, your neighbors, and your colleagues safe. We will continue to take precautions and exercise patience. And if we do that, we will all have a great summer. You have probably noticed more license plates from outside already, and that's a sure sign of summer. I just want to remind all Yukoners that it is to be expected and that these folks from outside, they need to follow the rules when they are transiting through the territory. As I mentioned 2 weeks ago, things are different this year compared to last year when it came to traveling from outside. Our vaccination rate is leading the country. It is now mandatory to wear masks in public spaces. The federal government has tightened up the rules for U.S. citizens in transit, including requiring COVID-19 testing and the use of mirror tags and decals on vehicles. These are all measures that mitigate the risk of transmission of COVID-19. Also keep in mind that more than 40,000 U.S. citizens have transited through the territory over the past year with 0 cases associated with these travelers. So please, again, be kind and respectful. I want to thank our partners with the Liard First Nation who are working at the southern border and helping keeping travelers informed. Again, if you have any questions or concerns, please contact our enforcement team at 1-867-393-6210. And with that, I'll hand things over to Dr. Hanley, Masicho, Ganesjish.
Thank you, Premier Silver. Good morning, bonjour. I'm pleased to say that we have no active cases in Yukon as of today, thanks to the cooperation of all Yukoners, so we continue to remain in a stable place. Over the past few weeks, as we have announced a trickle of cases here and there, despite the presence of variants, we have managed to maintain our containment approach. We continue to see that those who have tested positive for COVID-19 took all the necessary steps to protect themselves and those around them. With most people doing the right thing most of the time, we can maintain our control of this pandemic even as we start down the road of opening up. Opening up could mean more cases in Yukon. On the other hand, our ability to limit the impact of any single case or cluster improves dramatically as our level of vaccination in the population increases. Canada's tally of vaccine uptake is also increasing steadily, contributing to a slowly declining risk of case importation. We are in a good position now, and we can be realistically optimistic about our summer ahead. As the Premier mentioned, Yukon has recently passed the 75% benchmark of vaccination for first doses. People are continuing to step forward for first doses, particularly our younger adults. All Yukoners should be proud of our achievements so far. And with each additional vaccination, we are getting a bit closer to seeing normalcy return to our daily lives. Vaccination continues to be the biggest step we can take towards living in a place without as many protective measures needed. Now, I know we have reached a point where we are working more and more with a declining number of those who have been hesitant or holding back from receiving the vaccine. But each one of those persons is important for us to reach and ensure that they have an opportunity to have their concerns addressed and their questions answered. Our efforts are working as people get their questions answered and see their own reasons to get the vaccine. One group I would like to return to consider today is those who are concerned about fertility and pregnancy. Following the live Q&A event I participated in with Dr. Tam and Gurdeep Pandar the other weekend, I was able to revisit some of the questions asked within that short 45-minute period. Many related to how vaccination affects fertility and pregnancy. With regard to the vaccine affecting fertility, this is an unfortunate misconception that has rapidly spread throughout social media. There is no biological reason why this or any other vaccine should affect fertility, and no evidence or data to support this idea. For those who are pregnant and unsure whether or not to seek immunization, let me reiterate some of the messages I related a few weeks ago. First, the evidence is increasing that your risk of getting severe COVID disease is higher when you're pregnant. Now, we know that most cases of COVID-19 are mild, but sometimes, and unpredictably, the disease can be much more serious. That risk for severe infection has been shown to be higher in pregnancy. The risk of premature birth is also higher with COVID-19 infection. Next, we also know that COVID vaccines work just as well in pregnancy or for a breastfeeding mother. And as these vaccines are inactivated and therefore not live, we can be confident that these vaccines, like other killed vaccines, will be safe during pregnancy. In addition, we now have early but significant real-world experience with this vaccine in pregnancy, and to date, the data is very positive, with no safety signals being detected. There is also preliminary evidence to suggest that antibody transfer across the placenta does take place, which should help to protect the newborn infant, although to what degree and for how long, we still don't know. If you have any questions as to whether, when, and how to get the vaccine while pregnant, please arrange to have a conversation with your family physician or community nurse. You can also email our COVID info line, and we will do our best to ensure you are provided with the answers and the clarity that you need. With our recent announcement of exemption from self-isolation for those who are fully vaccinated, as of May 25th, next Tuesday, I know many have started making travel plans or are discussing plans with family and friends outside of the territory for the months to come. I want to provide as much clarification as I can to the many questions about who is eligible and who is not before this comes into full effect on May 25th. So I want to reinforce that anyone who is incoming to Yukon, whether a resident or not, must be fully vaccinated, which means 2 weeks past the final dose of a Health Canada approved vaccine. I want to add to the Premier's comments on verification for immunization. Many people have been working on this issue, and vaccine certification will be an ongoing national and international conversations for months to come. In the meantime, we are working on a local verification process that relies not only on the incoming traveler's declaration, but on the consent to have that information verified. I'm confident that we'll have a robust and reliable process, and we will continue to improve it as other jurisdictions continue to develop their own processes. I want to reassure you, though, that anyone who declines to attest that they are fully vaccinated or wishes not to consent to have their information verified by trained officials will be required by law under CIMA to self-isolate for 14 days. After immunization, it's important to note that we are not suddenly immune to COVID-19 disease. I have heard of a few stories of individuals who have received vaccination and gone on to swiftly shed their masks and expand their social bubbles. It doesn't work quite like that. Immunity builds with time. It does take a minimum of 2 weeks to build up immunity, and the effectiveness of the vaccine continues to improve beyond 2 weeks after vaccination. Although the data to date supports these COVID-19 vaccines as some of the most effective vaccines ever made, they are not in real life 100% guaranteed to prevent infection. It is possible to still get infected, and we have seen this in other parts of Canada, especially if exposed to high COVID activity, either within a household or within a public setting. Think about this if you are planning travel shortly after a second dose of vaccine. As you are booking, consider waiting for your departure until at least 2 weeks beyond that second dose. Waiting even longer provides better protection. For travelers, you must have 2+2 before entering the territory without the need to self-isolate. 2 doses plus 2 weeks following your second dose means that you are protected enough to mingle with others and enter public spaces safely. Now, I want to discuss some expectations about what to do and where you can go after return from travel, even though you may not need to self-isolate. We know that over the past 15 months, we have all worked hard on doing what we can to protect people who are more vulnerable to infection, or to reduce the risk of COVID spread should it be introduced into certain settings. Remember a vital but simple principle, that COVID spreads in crowded places where there is close contact between people. That is why it is so important to continue to work together to reduce the risk of spreading. Keep your social bubble consistent, and please continue to follow both personal practices as well as the COVID rules and guidelines in public settings, including healthcare and associated settings. Even while fully vaccinated, it is your responsibility as a traveler to observe and comply with local public health measures. Enjoy your travels and the visits you've been waiting for, but do avoid gatherings and settings where COVID transmission may be occurring, closed, crowded, poorly ventilated indoor spaces. For those who are coming back to Yukon and are fully vaccinated, we must keep in mind that infection is still a small but real possibility. We are also starting to learn that although the risk of transmission to others from a vaccinated case is low, it is still possible. Thus, we need to develop guidance based on recent and rapidly evolving evidence. We are working as quickly as we can to offer guidance to various types of facilities, whether businesses, personal care facilities, and healthcare settings, as to whether and how to welcome people who are fully vaccinated and who have recently traveled. Select guidelines are being developed, but not all will be revised and ready by next Tuesday. For general retail premises, restaurants, organized gathering places, and places of worship, I have no special concerns. As long as these businesses and organizations agree, people who are fully vaccinated and who have recently traveled domestically can be welcomed into these areas. All of these areas have designed protocols and practices based on operational plans in order to minimize the introduction and spread of COVID infection. Thus, the traveler who is fully vaccinated, who wants to grab a bite to eat, or go shopping, or rent a car or a bicycle, should be able to do so safely. Other settings, personal care services like hair salons, dentists, clinics, hospitals, and long-term care facilities will take some more time and consultation so that we can develop guidance. Please be patient and continue to follow existing policies for returned travelers for these settings. Please continue to abide by whatever rules certain premises have in place and be prepared not to visit these places during your first 2 weeks until we have had that chance to work with these businesses and organizations. Of course, emergency departments and health centers will continue to see people in self-isolation when there are emergencies, as they always have. As we move to a two-vaccine summer, we need to remember that reopening is a process of slowly and carefully peeling away restrictions, like layers of onion skin, as our vaccination rates continue to climb, and as we show success in working together through each step. As the Premier mentioned, I have made recommendations to government about social gatherings based on the many requests and emails from individuals and from the faith community. I want to assure you that we are addressing your needs and concerns very seriously. Some things you will notice when the new guidelines and orders are finalized. We have made the guidelines for gatherings as simple and consistent with each other as possible. The numbers are higher, but are within reasonable limits given the new environment we are in. And we continue to make distinctions between higher risk gatherings, social and formal events, versus organized gatherings where the risk is lower because these events are developed against a COVID operational plan. Our experience to date with organizers and operators of organized gatherings has been very good. So that's it for today. I hope you can all take advantage of this upcoming weekend and enjoy a bit of a reset and a rest. Please take care of each other. Remember to be grateful for what we have. And stay well. Thank you. Buenas noches. Merci.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll move now to the phone lines, and we'll begin with Luke, CKRW.
Hi, this is a question for the Premier. I know both you and Dr. Hanley mentioned the increases in numbers for indoor and outdoor gatherings, but you didn't mention a date. I'm wondering if a date for these restrictions lifting is this Monday or if it's in the coming weeks.
Yeah, we haven't released a date yet. The recommendation has been presented by Dr. Hanley, and now we will do the work inside the cabinet to get that OIC out, and we'll make that date available as soon as possible.
Do you have another question, Luke?
I do. Dr. Hanley, last week there were guidelines from the CDC in the United States about mask wearing for fully vaccinated individuals, but federal health officials in Canada were saying that mask wearing is going to continue and it's probably going to be one of the last things to be lifted. Do you share those views as well on masks and expect them to stay a little bit longer?
Yes, I thought actually that the quote from, and I believe that was Dr. Howard New, was very close to what I had previously said, that I see masks as a later, one of the latest lifting measures, because it's an individual action. It gives that individual protection as well as, of course, that additional layer. But also, there's no clear way of distinguishing, of course, between who's wearing a mask and who isn't. So our approach regarding masks is more of waiting for that achievement of high population immunity, and in this case, I would say that applies to Canada as well as Yukon, so that we could do this as a Canadian initiative rather than a local initiative. At least that's what I would foresee. Now, nothing is, of course, set in stone in a pandemic. But what I do think this has signaled is from CDC, and as you know, this surprised many people, but I think what it does signal is the increasing amount of evidence that we have that is now coming through from studies in the US, in Israel, in the UK, and it's showing more and more how effective these vaccines are in real life. So I think, if anything, it's taken as an attestation to the confidence that we have in the fully vaccinated effectiveness, real life effectiveness of the COVID-19 vaccines. And so I think it, if anything, it affirmed our approach and our current process, and added, I think, to our ability to confidently move ahead, even with our measures as of next week, where we are showing more and more real-world evidence that these vaccines work.
Thank you. We'll move now to Haley, Yukon News.
Thank you. I have a question for Dr. Hanley. I know it was mentioned there that the primary benefit for the changing quarantine rules is Yukoners, and it's been determined that British Columbians can have their health information verified. I'm just wondering where we stand with the other territories, since those are probably the other jurisdictions with the most second doses. Will travel be fairly smooth between the territories? Is there a way to verify vaccination status between Nunavut, Northwest Territories, and the Yukon?
Yeah, thanks. I can't give you details of that, and I know we've been having conversations for a while, and each jurisdictional conversation is different. It is easier, of course, to have those conversations with our northern colleagues, so I'm pretty optimistic that we'll have a process in place, but I can't give you any further details at this point.
Do you have another question, Haley?
No, thank you.
Thank you. We'll move now to Hina, Canadian Press.
Hi, this is a question for either the Premier or Dr. Hanley. I was wondering if you could tell me what the arrangement is with BC for travel, especially considering that there are quite a few variants of concern here.
Yeah, thanks for that question. So just to reiterate that the requirement for fully vaccinated applies to anyone who's coming in into Yukon, a Canadian resident who has that full vaccine status, and that we're able to verify. So we do have, because we share an information system with BC. Of course, there are privacy walls on each side of that, but we basically have a shared immunization registry that allows us an easier access to obtain the information based on if the individual consents to have us access that information. So that's where there's an advantage for BC. This isn't, of course, an interjurisdictional bubble. It does rely on vaccination and the ability to verify that. But we also, again, have now a long history, and especially throughout the pandemic, of having a very close collaborative working relationship with BC. And we are also seeing very good progress in the management of COVID activity in BC, and as you know, you're seeing those numbers now in all health authorities in BC start to decline. So BC is positioning itself very well, looking ahead to the coming weeks, and as far as I understand from following the BC public statements, they are still looking forward to, for instance, lifting the restrictions against essential travel by after the long weekend. So I think it just shows that from a COVID activity point of view, BC is really starting to improve and ahead of many of the other major provinces.
Do you have a second question, Hina?
Yeah, I do. Dr. Hanley, I was wondering, do you have any extra doses, and what happens to those now that most of the people there are vaccinated?
Yeah, I'll do my best to speak to that. We have no extra doses per se, so our dose allotments have been very closely aligned with our projections for uptake, including projections into the second quarter for an allowance for 85% uptake of eligible adults. So we've been, like the rest of Canada, trying to do our best to maintain that a close match between anticipated demand and supply, and our allocation is based on that, including some extra allocations for our children with for our age 12 to 17 youth with the special Pfizer allocation, and plus for our additional populations such as rotational workers, where we have been able to and are continuing to provide vaccine. So where I think we're sitting at a pretty tight connection, and I think we've managed that allocation and process well, and I don't think that we're sitting on unused doses.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, good morning. So my first question would be for either the Premier or Dr. Hanley. Not too long before the conference or the briefing started this morning, the Yukon Privacy and Information Commissioner released a statement, a joint statement from the commissioners across the country, essentially warning that these vaccine passports or certificates could be a bit of a minefield from both the legal and privacy perspective. So just wondering if you have any thoughts on that. I realize you probably haven't seen the statement.
Yeah, I would just say that at every step over the last 14 months, we've been very considerate and deliberate in our approach. Recommendations coming from an emergency, a pandemic, puts us into a different situation than regular governance and business. And I look at the success of our measures as a really important hallmark, but also our ability to make sure that we are working in lockstep, not only with the Chief Medical Officer of Health, but also the Department of Justice as well. We are very confident that our approach to the vaccinated individuals, and again, all Canadians, is well within, the provisions of the Civil Emergency Measure Act. And again, a testament to the strength of a coordinated community, which is, to me, the most important piece. If we want to see the other side of this pandemic, we all need to work together, and we all need to recognize that this is an emergency. And I think that credit goes to the Department of Health and Social Services for being so extremely professional in understanding, the mental wellness aspect of the pandemic, but also the importance of the guidelines and restrictions, because at the end of the day, you have a jurisdiction who has 0 cases and has used the measures and the guidelines in place to make sure that the ability for all Yukoners to do more and to be more by way of guiding us through this extremely difficult time in our history has got us to a place where we will we will be on the other side of this virus in the most efficient amount of time, and that's always been our approach. So I haven't seen the statement that has come out, but as far as the concept goes, I think as a jurisdiction we have done very, very well to take the guidelines from the medical community and assess that in the most proper way possible.
Thank you. Do you have a follow-up question?
Yes, I do. It's a follow-up on that, just briefly. In the same statement I received by email, the Yukon Commissioner says she hasn't been involved in any of these discussions on a possible vaccine certificate or passport. And your Minister of Health and Social Services said that yesterday as well to reporters. Don't you think that's some expertise that could be taken advantage of in what could be a contentious kind of program?
I think that we've been very clear from the get-go that we, once a recommendation gets formulated from the doctor's office, after consultation with the international, national community when it comes to the pandemic, that information becomes readily available to the public immediately. Also, our plans to then implement the policies and designs, the guidelines from there, again, that information is readily available.
Thank you. We'll move now to Philippe, CBC Yukon.
Yes, thank you. Quick detail, could you tell me more about the process of declaring or agreeing to consent of medical records? Is that something that happens, let's say, at the airport or at a roadside stop? How does that interaction happen? Where and when, please?
Yeah, more details are to come out. So again, once we get this finalized, we will definitely give the information. And the most important thing right now, Philippe, is to understand that we're going to ensure that this verification system, of this information, is done in the least intrusive way possible. I'm very confident that Minister McPhee's team in Health and also Justice will be able to work this out with our partners right across the country. And to be clear, no one will be compelled to share any personal health information. If an individual does not want to consent to providing that information, they still may enter the territory, as they can now, as long as they self-isolate for up to 14 days. I don't know, Dr. Hanley, if you have anything else you want to add to that?
I think you said it well. No, thank you.
Philippe, do you have a second question?
Yes, I wonder, do you know roughly how long it would take to check this information? Will people have to self-isolate perhaps the first day, waiting for the check to come back?
Again, more details about the process we'll make available as soon as those conversations with other jurisdictions get figured out. We are in a great place with Health and Social Services and our ability through different processes and technologies to share information. We've modernized our system in the last 4.5 years, which really puts us in a place from a technical side to be, on our side of things, very proficient in that sharing of information. Every jurisdiction is different, and those conversations continue.
Thank you. We'll move now to Vincent, Radio-Canada.
Oui, bonjour Monsieur le Premier ministre, bonjour Dr. Hanley. Juste une question, je sais qu'il y a eu des discussions avec les écoles et je voulais savoir si la campagne de vaccination et la clinique de vaccination dont vous parliez au dernier point de presse sera organisée dans les écoles.
So you talked about the school for vaccination of youth and would like to know if this vaccination campaign will take place in schools.
Oui, merci pour la question. Oui, je ne sais pas si ça applique pour toutes les communautés, mais je pense que pour la majorité des communautés, ça va prendre place en fait dans les écoles. Comme en fait la plupart des vaccinations, il y avait beaucoup de visites communautaires avant pour les adultes qui étaient aussi dans certaines écoles, dans les communautés. Donc c'est une chance pour voir les enfants sur place, mais c'est aussi pour la majorité des communautés l'endroit déjà utilisé et amenable pour toutes les logistiques d'offrir le vaccin. Is there anything I should add to that, Pat?
In Whitehorse, they will take place at the convention center.
Right,
not in
oui,
schools.
oui, juste pour vérifier que oui, pour Whitehorse, ça va prendre place dans le centre convention, centre communautaire.
Avez-vous nos questions, Vincent?
Oui, et juste pour confirmer, un Canadien complètement vacciné qui peut le prouver, qui accepte qu'on le vérifie, qui se présente à la frontière à partir du 25 mai pourra entrer au Yukon sans quarantaine. Je voulais juste savoir, est-ce que c'est s'il indique en fait que la décision de venir au Yukon est motivée par du tourisme, est-ce que ça sera maintenant, c'est la fin en fait du voyage complètement, de la règle du voyage essentiel, pardon. Et si c'est le cas, est-ce que dans ce cas-là, il y a des discussions avec le fédéral, puisque vous parliez, Dr. Hanley, la semaine dernière, voilà, qu'on était toujours dans un monde, dans un Canada où les voyages non essentiels n'étaient pas conseillés.
So you announced that fully vaccinated Canadians will be allowed to come into the Yukon without vaccination. And I would like to know if this means that your recommendation on non-essential travel are waived to the extent that people are vaccinated and are welcome to come in the Yukon to spend some time.
Oui, c'est une très bonne question et une question très importante parce que chaque fois qu'on a parlé de cette annonce et changement de règles, c'est accompagné par le conseil qu'on est toujours dans une situation au Canada où le voyage non essentiel n'est pas conseillé. Et donc, c'est une question, c'est une première étape. C'est pour reconnaître, surtout pour les Yukonais qui ont attendu la chance de voyager pour faire des visites familiales, pour avoir une repose hors du territoire. Mais au même temps de respecter les règles où ils sont toujours en place. Et par exemple, on attend en Colombie-Britannique qu'on va enlever les restrictions contre interrégional voyage non essentiel bientôt. Si ça passe, ça enlève un peu l'obligation pour les Yukonais de respecter ces lois. Donc c'est toujours lié avec les restrictions sur place qu'on prévoit avec les semaines de l'été, on va graduellement voir ces restrictions enlevées. Should I
think you've pretty well addressed that in English already,
Okay.
as I recall.
Oui,
Thank
okay.
you. We'll move now to Laura Boréal.
Oui, merci. Ma question est pour le Dr. Hanley. C'est quoi les lignes directrices qui font en sorte qu'il y a des restrictions de nombre quand l'activité est à l'extérieur avec la distanciation sociale et les masques? Pourquoi mettre un nombre maximum pour des activités extérieures?
So the question is essentially, why do we still have restriction on the number of people for outside activities if we still have to respect the distanciation and then wearing masks? So why do we have a maximum limit of the number of people that can gather outside?
Oui, merci pour ça. C'est aussi pour reconnaître qu'on fait chaque changement dans une série des étapes. Donc, éventuellement, on veut tout le monde arriver à un point où on n'a plus besoin d'avoir des limites sur les rassemblements de gens, surtout dehors. Mais il faut reconnaître que même que le risque est beaucoup plus bas dehors contre à l'intérieur, il y a toujours un risque, surtout avec le rassemblement de gens qui sont proches. Donc, toute mesure, c'est une autre couche de protection. Donc, le nombre, c'est une couche de protection. L'observance de distance physique, l'application de masques, de porter des masques, c'est une autre couche de protection. Et donc, avec plusieurs couches comme ça en ligne, on a un ensemble de protection contre la transmission de COVID. Donc, c'est la première étape et on espère qu'on peut arriver éventuellement avec une réussite à chaque étape à ouvrir même plus qu'où on est à ce moment.
Thank you. Avez-vous une autre question?
Non, merci.
Now we move to Paul, CBC.
Hello, can you hear me?
Yes, we can. Go ahead, please.
Okay. I just want to come back to the questions around proof of vaccination for people returning to the territory. May 25th is just 6 days away, and I'm hearing a lot of the answers to the questions about this. You know, we're still working on it. Stay tuned for details. How confident are you that you're going to be able to provide those details in the next 6 days around what people can expect if they leave the territory and come back, say, on Tuesday or Wednesday of next week? What are they going to have to do? How can they prove their vaccination? What's going to be required in order for them to not have to isolate?
I think we've been very clear that as far as the proof required, we're very confident for Yukoners and we're very confident for people from British Columbia, and we'll be working out the details for all other regions. To say that we would be ready by the 25th for all of the regions, we won't be there. But those conversations are continuing. We've, from the beginning, have talked, from the very first time that we talked about this recommendation, we did say that that verification is going to take some time and that we need people to be patient as we work with other jurisdictions. And also that for those jurisdictions that do have the ability to be verified, we still want to be very respectful of the travel recommendations in those regions as well. And so, as Dr. Hanley mentioned, that after the long weekend, British Columbia will be updating their travel requirements. Again, cautiously optimistic as you look at the epidemiology in BC, very similar to where they were in October as far as pure count. But again, that verification, BC and Yukon for now, we will update folks as soon as we get the verification for other jurisdictions.
Dr. Hanley?
Yeah, I'll just add, Paul, it's a good question. And apart from the other territories, just keep in mind that, 3% of Canadians have had their second dose. So, we're really talking, again, this is primarily an initiative for Yukoners. Yukoners have nothing to worry about. There will be the declaration process, and we do have that ability to verify immediately, so that they don't need to, Yukoners do not need to worry that they'll be having to self-isolate while this is figured out. That's not at all the case. As long as they're prepared to sign the declaration and the consent, then they will not be required to self-isolate. But the reality is, for that very small number of people from the southern jurisdictions who are fully vaccinated, those details are still being worked out, and I'm pretty confident will be available soon.
Thank you. Do you have a second question, Paul?
I do, and this one has to do with vaccination rates. We see according to the last vaccine tracker update, the vaccination rates for central Yukon are quite a bit lower than some other regions in the territory. I'm just wondering if you're doing anything to try to address that, to try to see those numbers go up, specifically in that central Yukon region where the numbers have been lower.
I can start.
Okay, go ahead, Premier Silver.
Whoever's playing the piano behind you is doing a fantastic job, by the way. I would say that we just implemented the most successful vaccination schedule that Yukon has ever seen, as far as how we got the campaign out about getting our shot, and this is your shot. Also coordinating with the First Nations governments and municipalities in all the rural communities to dispel the myths and rumors and misinformation. We've been very, very successful in that approach. So where it comes to some numbers and some demographics in other in each region, we're continuing to work with our partners in those regions to make sure that we have as many as possible healthy folks that can take the vaccine to take the vaccine. But again, to sit here in the Yukon and to announce that we have achieved 75% for the first dose, that's a remarkable accomplishment, and the credit is deserved amongst the dedicated people in health and social services to coordinate those efforts, to show that professionalism, to be able to use the vaccines that we were granted through rural, indigenous, and remote communities from the National Advisory Council. It's just an extraordinary effort. So I think at this point, we're very comfortable with the numbers we have. We're not done by any means. We're continuing on that campaign, the communications campaign, to make sure that we reach out to every single community, and now really turning the page to the Pfizer vaccine and working out the logistics details to get our youth vaccinated as well. So we'll continue on the amazingly successful path that we started with the campaign of this is our shot.
I'd like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, May 26th at 10:30 a.m.